Good evening and welcome to Transition Talks Tuesday with Juneau and Adams County, presented with New Lisbon High School. We are excited to be here tonight. My name is Tim Markle. I'm director of the Southern Regional Center for Children and Youth with Special Healthcare Needs. We're partnering to put on Transition Talks Tuesday. And tonight I have a co-host here because we get to talk tonight.
Yes, we do.
What are we going to talk about as I get the PowerPoint going?
We are going to be talking about healthcare transition and how to bridge the gap between being a child and an adult, especially those with special healthcare needs.
That's pretty good. I'm getting to where I don't need to be here anymore.
Now you're going to need to be here because this is technically your job.
It's a really, really good point. Thanks for reminding me that
No
it's
problem.
6 o'clock at night and I'm still working. Okay, but but there are school people that are doing the same thing. So
Yes,
I'm in really good company. All right,
you're
so
an amazing company.
my name is Tim Markle. I am parent to this wonderful dude who's 24 years old, and he can tell you anything about him in just a moment. But I do work for the Weisman Center as director of the Children and Youth with Special Healthcare Needs program. I also work with the Youth Health Transition Initiative, which, as you maybe put, is all about helping families and providers, medical systems, and especially youth transition from pediatric or adolescent care into the world of adult healthcare. Even if they're not changing doctors, they're changing systems.
Yep.
And so there's a lot of stuff that we can do beforehand to get prepared for that.
Well, as prepared as possible.
As prepared as possible. You want to tell them a couple of things about yourself?
Well, as he already stated my age, my name is Hunter Markle. I am this man's son, and I am not regretting that at all, period, because I love this man.
And I love you too. Now, you want to tell them a little bit about any special needs or anything that you have?
Well, I am on the autism spectrum. I also still have high anxiety. I have also done a in-care, I wouldn't really call it rehabilitation, but
No,
more
just
of inpatient stay for depression and wishing to
Yeah.
commit suicide
Yeah.
a few years ago.
So we're really happy you're here.
I'm very glad to be here as well.
Yeah, absolutely.
I like working with you.
I like working with you too. So that's a little bit about who we are personally. Let me tell you a little bit about who we are representing. And so we are part of what's called the Children and Youth with Special Healthcare Need Network in Wisconsin. And that includes partners like Parent of Wisconsin, Parent Matching Organization, Family Voices, which works with advocacy, ABC for Health, that teaches us a ton about health insurance, as well as the Well Badger Resource Center, which is a fantastic source for statewide information. We have two national performance measures that the Children and Youth with Special Healthcare Needs program works on. One is Medical Home, which is basically partnering with your child's doctor for the best outcome possible. And the other is Youth Health Transition, which is why we are here tonight. A lot of our work, though, gets done through the 5 regional centers throughout Wisconsin.
I originally always thought there were 4.
But I said them right. And
Yep.
so we have 5 very colorful regions. And so wherever you are in Wisconsin, you have a regional center for children and youth with special healthcare needs that is there to help you find resources, to help you figure out what your next step may be, to help you navigate the system. When you're having issues with the system, we can help you problem solve and troubleshoot those things. We all do trainings, as well as also provide opportunities for advocacy and leadership, because we very much believe that families should be not just at the table, but need to be at the head of the table for places that are affecting our families. And so we really promote leadership and advocacy. So that's the context of what we're in. Again, we are the Youth Health Transition Initiative of Wisconsin, and that is not our official mascot.
No, that's the abominable snowman / Yeti, very poorly spelt.
Yes, so that is my personal
Yes.
mascot.
Very much so. And yes, you can count how many Yetis there are. No, there's no prize afterwards.
It's a good point. No prizes, no prizes. And actually, I'm not even sure how many there are. I keep changing the PowerPoint. So
yes, you do.
So yeah, feel free to count the Yetis and let me know how many Yetis are currently inhabiting the PowerPoint.
Mhm. They like to call it home.
There you go. And so the reason that the health transition is all about ensuring high quality, developmentally appropriate healthcare services, make sure that they are available in an uninterrupted manner as a person moves from adolescence to adulthood. Basically, we believe that, well, the slide says that transition starts in early adolescence, but all parents know that transition starts at the birth of your child. Is that from the time that child is born, we are thinking about their life and what their life is going to contain. Planning for the transition into adult healthcare can start to take place in early adolescence. So even at 12, 13 years old, we can start to build some skills and some knowledge and some attitudes about managing your own healthcare as an adult. Now, in a part of the transition process is a transfer of care. And this is when the actual medical record gets moved over into the adult healthcare world. And so we have this process of transition. We have the transfer of care, but transition isn't complete until that youth is fully integrated into the adult system. And so this three-part, this on-ramp, the transfer, off-ramp, is all part of transition.
Yep. And unlike the belt line, it is never congested.
You're right, and you get to move at your own pace.
Yep.
Oh, so what do? We are really big in trying to help healthcare providers to help families transition, that we start to get healthcare transition as something that's real inside our healthcare systems. We have a quarterly learning community that everybody is invited to. We have an awesome website where we lay out details to the tools that we're going to cover tonight. And then we go to a lot of training such as this one, exhibits, and community partnerships.
Yep. And I believe we have a conference coming up near the end of April that we're both going to.
We will be at the Autism Society of Greater Madison Conference. Absolutely. So if you're there,
you're there. If not, I hope they have recordings.
Yeah, I don't know if they did.
Yeah, no.
No, that's the only way to see, see you is to be there.
Yeah.
Okay.
Yeah. Well, possibly. We don't know.
Okay.
We don't know the full setup.
We don't know. So we're going to talk a little bit about what is healthcare transition. We're going to give you a readiness assessment because it's really good to know where you're at if you want to know where you're going to go. So let's find out what the strengths are.
Right?
Yes, we love Got Transition.
Got Transition is an amazing national program and everything.
We're going to talk 8 tools for healthcare transition and then hopefully talk a little bit about advocating for your own health.
Yep. And on the concept of advocating for your own self.
Yeah. Do you remember this photo?
Yes, that is up in Door County during my grandparents' 50th wedding anniversary or 25th?
I believe so. No, I think it's 50th. Yeah, that was a good time.
It was an amazing time.
So where were we in this picture?
We are out in the stone at Fish Creek is the small town we were at. And it was a long, hard, arduous process to get me out to said stone.
Why is that? Why did you not want to go out on the stone?
Well, one, I did not know how deep the water was.
It's pretty deep.
2, some of the stones looked more slippery than the ice that can form down here in Stoughton.
True.
And 3, I straight up did not want to go out there. I just did not want to go out there, period.
But we had a goal.
Oh, yeah, the goal was getting me out there.
The goal was getting out there. So do you remember the different steps that we took to
reach first it was
goal?
one of my cousins,
Yep.
Then it was my sister, then it was you and Mom, and then you guided me out there.
Yeah, so we had people represent along the way, show you that it could be done.
Yep.
We gave you plenty of time to get used to your environment.
Yep.
And then we showed you the exact steps you needed to take to get out there with having a supporter out there with you.
Right. Kind of like having a supporter for your healthcare transition, be it a parent, a legal guardian, or just a friend or a trusted doctor walking you through the steps.
Absolutely, because we can't
Or
know
a teacher.
everything. Oh yeah, teachers are good at that.
Teachers, guidance counselors, anything that to get you through healthcare transition, you better have a good advocate.
That's true. So what is healthcare transition again?
Healthcare transition is the process of changing from a pediatrician doctor to an adult doctor in the healthcare system.
Yeah, and sometimes people don't have pediatricians, right?
No, sometimes they have specialists and everything, and that specialist care might not be able to transfer over to their new hospital, so they have to go through that same process of finding the specialist again.
Yeah, so that one part of healthcare transition is the whole sense of who is going to provide my medical care.
Mm-hmm.
And no matter, even if you have a family practitioner who sees people of all ages, chances are there's going to be changes from how you were treated and everything you had to do as an adolescent to when you're an adult.
Yep.
So even if you're not changing doctors,
No.
there might also be some changes that you have to take into consideration.
Mm-hmm. You
So-
should always take in any form of consideration for changes because life is ever changing.
Very true. So who needs to think about transition?
Teens, their families, the teachers, the medical professionals, the family pet. Wait, no, not the family pet. I don't think they have the brain capacity.
I
for
don't
that.
think they would care. No,
No,
not the pet.
Not
not
the
the
family
pet.
pet.
No,
Uh,
no.
The family in general, politicians.
Politicians really should care
They
more
should.
about transition.
They
You're
should.
absolutely positively correct. And why is it more important, or why do youth with disabilities or healthcare needs, why do you think that they need to really consider this more?
Because some of them might not fully grasp the idea or need very heavily specialized care
Oh,
and everything.
yeah.
Or it's a combination of both. Or they just could be nonverbal entirely, and that's their only disability, is that they don't verbalize at all.
Mhm. They have other ways to communicate.
Right, they have other ways of communication and everything.
So we have some, you're right, we have some youth that it's really important that their medical care, it just stays connected, as they can't have any gaps,
Right,
as they can be really dangerous.
exactly, and any size gap could just have said child fall through.
And that would be bad.
Right,
And then we know, like with autism, sometimes autistic people miss on some of the social cues. And so a
Right.
lot of transition is learned by watching other people transition.
Mhm.
And you just sort of learn it naturally, and it just sort of comes to you, and
No,
doesn't work with some people on the spectrum. huh? No.
This ain't going to be a river. This is going to be a waterfall.
There you go. And so with all that waterfall, everything coming down, is it helps to plan out
Mhm.
and learn the steps and how to do it.
Yep.
And not just assume that it's going to happen naturally.
No, never assume, because that just makes an ass out of yourself and me.
Thank you so very much for remembering that.
You're welcome.
So why is health so important?
Well, it leads to increased independence,
True.
successful day-to-day life, secondary education, and having a job.
So I would go as far to say that health is one of the foundational elements of success.
It's a keystone. It's a very
Absolutely.
important keystone.
The more you understand your health, the more independence you can have, because then the
Mhm.
more you know what your limitations are, but you also know what your strengths are.
Right.
And so you can push yourself more.
Yep.
And if we can stay healthy,
Just don't push yourself to the breaking point.
absolutely not. And if you stay healthy, then you can be more independent.
Exactly.
And then the success in day-to-day life, well, I mean, obviously,
That's
if you're-
self-explanatory.
if you're not well, it's really hard to get through a day.
Exactly.
And then secondary education. Did you know some people go away to school?
Yes.
And so it'd be really important to understand what's the healthcare at that college compared to at home.
Right.
How do I stay healthy so I can go to class?
Especially in these trying times of CV-19 and everything, and it's
Definitely. And then working. Well, what's healthcare have to do with working?
Again, with COVID and everything, by being healthy, it means you can work better hours,
Mhm.
more hours, keep your coworkers safe, keep the customers safe, keep your working environment safe
Mhm.
by being healthy.
And then a little bit later on, we'll also talk about how important it is to talk to your employer about your healthcare. And that can also include about your disability.
Yeah. Whether or not to disclose to said employer or not.
All right, so here's a quiz for everybody. See if y'all can follow along here. What happens at age 16 that has to do with the transition?
I don't have a drum set, so I can't
Oh.
really do the drum thing.
Oh, that was a really nice
Yeah,
try, though.
no.
Thanks for trying that.
No
Most
problem.
everybody is thinking
Driving.
Yeah, right,
Driving
exactly.
license, temporaries or permanent.
Well, you
It-
start with
it's-
temporary. Everybody
yeah,
start,
yeah.
Start with the temporary.
Yeah, some people really get through their temporaries faster than others. I'm not one of them.
No, we did learn, you're right. We, that's okay, because we learned that you can renew a temporary license.
Yes, we also learned that you're not allowed to drive out of the state you get to temporary license in.
We learned that after the fact.
Very much so.
Yeah, you're not really allowed to drive on a temporary license in another state.
Yeah, thank
no.
you for exposing me to the Ohio Turnpike a few years earlier than I should have been.
True story. And then what do most people think about at age 18?
Voting.
And is that important?
Oh, very much so, because it can influence your city's politics, your state politics, and then the federal politics.
Very good. It's very important that you know the issues and you understand how it impacts your life.
Yep.
And
you also get to become an adult.
Yeah, that old fun thing of
Yeah.
being an adult. Not as fun as it's cracked up to be, huh?
It definitely has a lot of cracks, but they're not upwards.
That's a good point. And so then at age 21 in Wisconsin, what do you think most people think of?
Alcohol.
Yes,
And
they
its
do.
responsibility to drink it.
Yeah. No, it's not responsibility to drink it. It's to drink it responsibly.
Yes.
So, yes, age 21 is your responsibility to drink in Wisconsin. Very good. Not, that is so not right. So not right.
No, it's
Okay.
not.
So all these things are leading to this huge thing of
Being an adult.
yes, becoming an adult. And it's there and it's staring you in the face and
Yep.
it's huge.
Very huge.
And you don't have to take it all in at once.
No, never
No.
take it all in at once.
And so with
That's how you crash and burn.
it could be. And so with healthcare transition, we like to talk about staying a step ahead. Is that there
Well, as
are,
best as you can.
well, right, as best as you can. Is look ahead, see what you can do today to help prepare you for tomorrow.
Yep.
Okay, so we believe that there are some knowledge, skills, and attitudes that you can build starting at age 12 to 14. And then maybe there's more you can build on at 15 to 17. So then instead of trying to leap right into adulthood, you're like preparing yourself
Yep.
to become an adult.
Yep.
So let's look at some of those tools and resources that we have.
Like transition.
Dude, the readiness assessment is like the first tool up here.
Yeah.
Absolutely. So we want to start with what do you already know about
About your health.
Exactly. And so we very much rely on the folks at Got Transition. They are our national partner, but there are other transition assessments out there.
Yep.
But I know, especially in education, that you really can't make a plan without having an assessment.
No, you always need assessments on top of your assessments.
Right. And you have to have somebody who assesses your assessments
Right.
to make sure that you're assessing correctly.
Yes.
All right.
That's why we have the Board of Education.
Do you think they're the assessors?
No, they hire the people to do the assessing.
Oh, very good. So the one that we have on the screen right now is a transition readiness assessment out of Got Transition that was specifically designed for a school in Washington, D.C. And so they then worked with the school in DC, and then they made this tool that could be used as part of the IEP meetings or as part of the post-secondary transition plan meetings, the PTP. And so I know that you can't really see it there. So let me pull up some of the things that it says. And the reason why they use this assessment is because you can then easily write goals for the post-secondary transition plan, write goals for the IEP. So
And plus, you can also just generally spring this on your students as well. It's just a general assessment and see how everyone feels about it as well.
because
It's just not for people with disabilities or
because
not.
people love pop quizzes. They just
Yeah.
love having things spring on them.
Yes.
Okay.
And again, this is a good way to see how they wish to view their health as well.
Yes, and you're absolutely right. It can be used with all students.
Mhm.
Because it doesn't have to be just for special education students,
No.
because these are skills that everybody needs to develop.
Exactly. This isn't a one be all assessment.
Correct.
This isn't like the ACT or SAT.
No, thank goodness. So an example of an assessment item would be a youth. You could ask a youth, I can name my learning differences, like a disability, medical or mental health diagnosis, And what they would be responding is, yes, I know how to do that. I want to learn, or no, wow, I don't know that. Now, sometimes the answer may be, I'm never going to have to. It's that for some reason, it's just, they're just not going to be able to. But most of these are things that most kids with disabilities will be able to work on. And so if that's one of their goals, if that's what they want to work on with transition, well, we could write into the IEP by the end of the IEP cycle, Hunter will say aloud or spell out or enter into their cell phone the name of their diagnosis and health diagnosis with blank percentage of accuracy.
62% accuracy.
If you want. And that could be written in just like any other IEP goals.
Yep.
All right. But it's not just for IEPs.
No.
And so we have different transition readiness assessments that are just general assessments. But all of them share the characteristics that it's going through some of those skills that we want them to be able to work on, that they can work on before they become an adult. And so we're assessing, what do they know? What could they possibly want to know?
Yep. And if you're worried about your Spanish speaking students, do not. They do have the assessment in Spanish.
They do. And one of the things that I really like about the GOT transition assessments is you can download them and you can personalize them. You can take some things out, you can add some things in, you can put your own logo on there, as long as you still have this little thing at the bottom.
Yep.
It doesn't matter, as they want them to be used.
Yep.
All right.
One way or another.
That's one way.
Another. And
Okay.
before we break out into a good song.
Absolutely. Let's talk about tools. Let's talk about more tools.
Yay.
And so you're going to find all the tools that we're going to talk about are available at the Health Transition Wisconsin website. And we will send this PowerPoint out afterwards. There are additional resources on that site.
To send it out afterwards.
Yes, he will.
Along with the survey.
And so let's talk a little bit about these tools.
Yes.
Let's start with adult providers. And dude,
yes.
I am gonna take a little break, and
Okay.
you tell your story of adult providers.
This is going to be fun. I'm going to take over your chair.
All right.
All right, so my transition from adult care providers didn't fully start out well. My pediatrician at the time, I was 14, maybe 15 years old. My parents just simply asked said doctor, can you start seeing Hunter alone? And they were like, why? They then came to me and asked the same question, do you wish to be alone with your doctor? And I asked, why? Neither me nor the doctor really were doing asking the right questions. My doctor at the time was not a full family doctor. He was more of a pediatrician / child working doctor. And then my dad introduced me to his healthcare team and everything.
Okay.
And his primary care doctor became my primary care doctor. Thank you for moving my unopened can of Pepsi over. And from there, we just clicked. And he has been my primary care doctor ever since.
So what is it that you like about your primary care doctor?
Outside of the fact that he laughs at my jokes,
That's a good
understands
sign of a doctor.
to break down medical jargon into words I can understand, accepts me for who I am, and understands that I'm going to be a little slower on the uptake about my health than a neurotypical person would be. And the fact that he always has a smile on his face, even with being mashed up, you can easily tell he and his team are all smiling.
That's a good sign of a good team.
That's an amazing sign of a good team.
So the other thing that we think about with adult providers is that the other way that people can find them is they can ask their current doctor about who they might recommend as a primary care person. And that goes for specialists too, as there are a lot of specialists that are very good at treating childhood diseases and childhood conditions, but they don't really understand the adult body or the way that adult condition is. So you may have to change to an adult specialist as well for some of your chronic conditions or some of your care. One of the important things that you talked about too is we really stress the importance of, as early as makes sense, is having that child that teen have some alone time with that doctor.
Yeah.
So that they begin to understand that it's their health that they're talking about, that they are the patient, that the doctor should be talking to them as much as, again, developmentally appropriate. But establish that care as a doctor to patient, but also to give them a chance to talk about things that maybe are a little sensitive around their parents. Is a lot of times we tend to, it just seems we think that people with disabilities maybe don't have some of the same problems, questions, issues that neurotypical people have. And so we don't give them the space to ask those questions in a way that is honoring to them. And so we really try to promote that as an early on, something that you can do at an earlier age. Second tool is this whole decision making, is wanting to be able to make decisions. Now, when do you think you started making your own decisions?
About 12, maybe 13.
If you started making your own decisions at 12 or 13, we were really rotten parents. Because we started giving you decisions to make when you were young. Do you want to use the blue crayon or the red crayon? Do you prefer the biscuit or the croissant? Croissants. Do you
Stop making me hungry?
And so we build in allowing choices and allowing decisions so that you can learn your preferences, so that you can learn your likes, you can learn your dislikes, and so that you can have control over your environment and over your life.
Well, as much control as possible.
Exactly. Well, that decision-making is, as you make decisions growing up, guess what? You get better at making decisions. So if the first decision you've ever had to make in your life was at 18, chances are you're not very prepared to make that decision.
Oh dear gosh, no.
So we want to work on building that decision-making capacity because it becomes really important at age 18.
Yep.
Because all of a sudden, who gets, barring anything, any guardianship or anybody stepping in, who's legally responsible for, who became legally responsible for your decisions at 18?
Me, myself, and I.
Darn right, Tootin', you did. Is that decision-making switches from the adult to the youth unless something else changes.
Yep.
And so let's prepare them to be able to make the best decisions possible.
Well, as prepared as possible.
Prepared as possible. Now, we don't have time to go into all sorts of the different types of supported decision-making, but if you come back in May, we have arranged to have somebody talk about supported decision-making, which includes guardianship.
Isn't there like 5 to 6 within the legal borders of Wisconsin?
There's a lot more different ways to have supported decision-making than people think. So yeah, absolutely. Health insurance.
Oh, joy. Health insurance. Yay. Something my sister really could have done early on.
What lesson did your sister not learn about health insurance?
That you better find a hospital in care.
A doctor, yes, a doc, not a hospital.
Not the hospital, but in doctor care.
Yep.
With it in network. That's the term I was thinking of.
There you go. So that there is a difference between in-network care and out-of-network care, and in-network doctors and out-of-network doctors. And one of them is a lot more expensive.
Yeah, out care.
Yeah, out-of-network care. Yeah, out-of-network doctors are a lot more expensive.
That was a very large dollar sign.
How do you find out if your doctor's in network or out of network? Are you just supposed to know these things?
No.
How could you know?
Figure out your house insurance and call someone that works for your house insurance company and ask them, is this doctor or this doctor at this hospital part of this health insurance network?
So how would you find that number?
By looking at your health insurance card.
Most health insurance cards have those 800 numbers that you can call and ask questions such as, what's my copay? Is this doctor in network or out of network?
Yep.
What hospital do I need to get taken to if there was an emergency? A lot of them also have numbers about, I don't know if I need to see a doctor. Can I talk to somebody about whether I need to see a doctor or not?
Yeah, the on-call nurse.
And do you know what other important information is on a health insurance card?
Beyond the health center for said insurance card and the on-call nurse.
Yep, there's a bunch of numbers on
Yeah.
there that are really important, like the who is going to pay for this visit. So like on the health insurance card is who is the primary card holder, it has your insurance number, and your doctor's going to need all that information.
Yep.
To be able to get reimbursed, to be able to get paid.
Because money makes the world go round.
Unfortunately, it's probably true.
Yeah.
All right, what do you want to say about emergency contacts?
Have them in your cell phones and carry your cell phone with you. I've learned this many a time. Always carry your cell phone or other medium of communication.
Smoke signals?
If you have a trunk room.
Ah, okay. So carry your cell phone with you and you can put your emergency contacts in your cell phone.
Or on a piece of paper in your car.
Yeah. And do you
Or
know
other mode of transportation.
Do you know where people could go to find out how to put emergency contacts into your cell phone?
The internet.
It could be the internet. There might be a specific place called Healthcare Transition Wisconsin.
Yes,
Specific
as well.
case that you can go. Where would you send people if they want to learn how to do that?
The Wisconsin Healthcare Transition website
That's
that you subtly told me about.
Fantastic idea. Yes, we have directions on there about how to enter in a what are the kinds of phones?
Flip phones, iPhones,
yeah, iPhones. There you go.
Blueberries,
iPhones are blueberries.
Yes. Yeah.
Oh,
BlackBerry. There we go.
I'm like, what the hell's a blueberry?
No,
I
BlackBerries.
want a blueberry phone. That sounds delicious. Okay,
We
so
want blueberries
emergency.
now.
Oh, I'm hungry. So yes, emergency
We'll get food
contacts.
after this.
Put them into your phone. One of the things that you could work on at a young age is appointment making.
Yeah.
Is how to set up appointments, going up, checking yourself in at the desk. That's an
Making sure
important
to actually
step.
call in to set up the appointment. Which,
Yeah. So how'd that work for you? How much did you enjoy calling and setting up an appointment? Not at all. So he is of the generation that believes that phones are mini computers and should be used as mini computers and really are not communication devices to talk to other people on. That's not what phones are for. Maybe texting, but they're not to talk to somebody else.
No. Well,
So,
we use primarily our house phone for appointments.
That's true, we
early
did.
on when we had them.
so do you remember the steps that we took to help you to make your own appointments?
Well, it was first of me just calling and then walking out of the room.
That's true.
And then the next step was me answering with, "Hello, my name is Hunter," and then leaving the room. But, well, not really leaving the room, just walking away. Then the next step was answering the very basic questions of when's my birthday, what's my home address, zip code, and all that. And then finally making my own appointments over the phone. And then good old SSM House / Dean Healthcare people came up with my chart. Oh, my chart was quite literally the ray of sunshine in already a lot of ray of sunshines.
What do you use my chart for?
Appointments, medication checkups, healthcare team, bills,
Yeah. So
a
that,
lot. There's a lot you can use it for.
excellent. And so now
Well, I don't think you can use it as a dating website.
you should not anymore.
No.
Don't do that.
Don't do that.
So you go to my chart and you make your appointments through my chart.
Yes.
And then how do you go to your own appointments now?
Yes.
How do you get to your own appointments?
I drive.
How do you find them?
Google Maps.
All right. So you have
I
all of
used to
these
use a
supports.
GPS, but now I use Google Maps on my phone.
So all these supports to help you take care of your own health care.
Yep.
Cool. All right. Let's talk a little bit about really quickly medications.
Yes.
Now you're not on any heavy duty medications right now. You have
No.
been in the past. You've had
Yes.
prescriptions in the past,
Yes.
but you do have a regular set of vitamins and supplements that you take.
Then I need to start taking again.
That-
Work. has-
Ooh.
Yeah,
Oh,
yeah.
so we got a glitch in the system.
Yep.
Okay, so now we're going to have to problem solve that glitch.
Yep.
But before, the glitch in the system was you just wouldn't remember to take them.
Correct.
And so what happened to help you remember to take your medicines?
Well, the first step was actually making sure I had the bottles.
True.
Second step was the pill organizer, which was filled by my lovely mother, who is laughing in the background at random things she finds.
Yeah. That's her.
That snort back there would be mom.
It's all a family. It's a family thing.
Yep. So she was the magical pill fairy.
Yes, she was.
Then I started filling up the pill organizer, and then I started taking the daily doses straight out of the bottle. And then I talked to my doctor and found out I needed to take not one vitamin D, but two. Needed to take 2,000 milligrams. Yeah, 2,000 milligrams of vitamin D supplements daily.
So then there's a glitch.
Yes.
Something happened.
Yes, I got a job.
Okay, and so your schedule changed.
Yes.
So what's your plan to get back to taking your daily stuff?
I'm working on it. It's not working well.
So we can work on another plan. And yeah, I mean, I don't get it right all the time.
No one gets it right all the time. If they did, they wouldn't be human.
So we make a plan and we work the plan. And then if we stop working the plan, we make another plan.
Yep. A man with a plan whose name is definitely not Stan.
So then we're going to also talk a little bit about the health summary,
which you can actually find on my chart. Well,
yes.
Your account of my chart, not mine. Yep. It would be very weird to have your health information on my chart account.
That'd be very illegal.
Very much
very
so.
Illegal. Very against HIPAA. So that health summary is what you need to remember is that you want to make sure that you have in there in your medical record what is important to you. Because by the time you get to be 18, you can have all sorts of stuff that have gotten into your account. And it's most likely electronic these days.
Yes, very much so. We don't have entire basement areas filled with filing cabinets anymore, man.
No, that's what I grew up with, and medical records and all that good stuff.
Oh no, we still have medical records. They're just no longer paper.
Okay, so electronic records. So the health summary is a way to take all that information
and condense it into one small little computerized chip.
Yep. And so you want to make sure that what's important to you gets put in that health summary so that it's right there at the top for when your new doctor takes a look at it.
I'm now hungry for potato chips.
I don't know why. And so the health summary is something that you work on with your doctor and can be in your electronic records. Now, you can also, if you're going to change systems, you can also get a print copy of that as well and take it with you.
Yep.
And
it also can hold release of information.
Yep, you could have your release of informations in there.
They needed that because of an MRI that I did.
Yeah, so just in case you're not perfect at this, so Hunter had him an MRI done, and since the time we scheduled the MRI, and he actually had the MRI, he turned 18.
Yep.
And so
I needed to give a release of information consent form paperwork thing.
Yep.
Again, bureaucracy for the win. We bury ourselves with it.
It's about your privacy. I mean, that was really important.
That was a very big important piece of bureaucracy.
But I wanted to see the results as well. And the only
way
I
wanted
could
to see if I had a brain or not.
I did want to see if there was really a brain in there.
Good news, I do have a brain.
It's there. It's there. We have proof. We have pictures.
Yep.
But the only way that I could
which we will not be showing.
That's right. But the only way that I could do that is to have him sign a release of information. So the final tool we want to talk about is about me.
About you? I thought this was about healthcare transition.
Okay, let's make it about you.
We already did that segment.
Who's on first? Okay, then. So about me, and this is your chance to really say, what pronouns do I want used? How do I prefer to be called? What name do I prefer to be called? What arm do I want my shot in? Any sort of preferences that you might have, and you can write it out so that you can use it as an introduction to your new doctor.
Yep.
And you can, so that they have what's important to you, maybe your maybe your sports, if you're involved in sports, or your hobbies, whatever is most important to you. Doesn't have to be about your health,
No,
but it's important to you so that this doctor gets to know you a little bit better.
it's basically an introduction portfolio.
There you go. And so those are the 8 tools. We go in depth of those onto our website, but I wanted to show you a new, very busy slide that I just made the other day. I call this.
What the crazy spider web did you work on?
This is healthcare transition in one slide. So it's one slide that covers everything that we just talked about. It includes the different areas of things that you prepare as you're preparing for transition. This on-ramp that we talked about is you can start early talking about having people talk about me. What is it about me? What are my preferences? What do I like? We talked about how decision-making can be grown. Emergencies, who are you going to contact in emergencies? This includes talking with youth and helping them understand, who do I call when I'm not feeling well? Who do I call? When do I need to call 911? When do I need to call my doctor? What do I do if it's 10 o'clock at night and I want to see my doctor? I know my doctor's not in the office at 10 o'clock at night. So what am I supposed to do? Do I just call an ambulance? Probably not. That's probably going to get expensive. And so how do I take care of my health care?
It is expensive.
You know that one too.
I know that one very well, thanks to a dislocated knee.
True. And so emergencies can also be about who do I call when? When do I call who? Making appointments, and as kids see, medications can work up. Now, we also have this decision-making again at the transfer of care. And that's because it's here where the family has to decide and the person gets to decide who is going to make their future decisions about their health care. Up until this point, the parent has been in charge, or the guardian has been in charge of making those healthcare decisions, hopefully talking with the youth. But here at 18 is by default, the youth starts to make those decisions unless something else is in place. And then here's that transfer of care. And then hopefully we get to the point where the youth is fully integrated into adult healthcare.
I like that word, hopefully.
Hopefully, that's right. Again, the transition ready assessment, know what you have, learn what you need to have, make a plan to get to where you're going. This is all about building your KSA, building your knowledge about health, knowledge about yourself, building skills to make your way through the healthcare system, and then having an attitude of competency, that I can do this, that this is mine, an attitude of interdependence, as none of us are fully independent, but I can still be in charge. So an attitude of being in charge of my healthcare. Mm-hmm. And the important thing that we ask along this whole thing is, what part of this can the youth be doing? How can we grow those skills? What can the family do to help prepare the youth
or guardian
to transfer that care? What can health professionals do in this? What can educators do? Whatever your role is, as a supporter, as a fellow family member, as a friend, if you have someone who is preparing for adulthood, approaching adulthood, how can you help them to prepare for their healthcare transition? So that's my healthcare transition in one slide.
Yes, it's a very chaotic slide.
Very chaotic slide. But we believe that all of these skills will be useful, and healthcare transition will be useful, not just in healthcare management and in clinics, but also in employment.
Yep.
Being able to disclose and being able to talk about your healthcare needs and being able to take care of your healthcare needs. It's tied to independent living. How far away can I live from my supporters? Do I need to still live with my supporters?
I don't live that far away from my major supporters.
We are very thankful.
I'm just down, I'm quite literally just down a set of stairs.
And we're happy about that.
Yeah, I am as well.
How does your healthcare work in post-secondary settings? It can be part of the post-secondary transition plan that your school works with you on. And then this whole area of self-advocacy.
Yes,
your life is your life. And
yep.
You have a right to talk about it and speak about it.
Yep.
The rest of these slides, I'm just going to go through really quick because we'll get you the slideshow.
It's just basically websites, tools, and other doodads and
right. So we have the links to the Transition Improvement Grant, where you can learn more about the post-secondary transition plan. You can also go back and listen to the recording that we did for Transition Talks Tuesday with our own Julie M. and Brian Kenny. And we have a special guest on there as well, not Hunter, but a really cool dude. You're going to want to listen to him. I'm talking about post-secondary transition plan, and also learning more about self-advocacy, about how you get to choose what part of your life.
What are we going to be talking about the ADRC?
We have a whole session on ADRC.
Oh.
I tell you, a whole recording on your Aging and Disability Resource Center and how
Nice.
useful they are.
Yes.
So briefly, if you want to look at what we've talked about so far,
The timeline of transition.
is that starting at 14 is the school has to start to talk post-secondary transition plan, the PTP. We recommend contacting the Aging and Disability Resource Center at about 17 years and 6 months. This is especially important if you're receiving public benefits such as children's long-term support waiver help, because the ADRC will help you then apply for and see if you're eligible for the adult waiver. Again, go back, there's more on that.
There's a whole recording session on it, apparently.
Guardianship needs to be decided who is going to make the decisions. Guardianship is the most restrictive environment. There are levels within guardianship, but there's a lot of options before you look at full guardianship. There will also be changes if you receive supplemental security income. That will also have to be changed. You can go to the ADRC for that. And then the all important who is going to be making the decisions.
And somewhere in there, you get to be tossed into the draft system.
Yes, you have to register for selective service.
Yep.
So if we talk specifically transition,
Oh, it's my favorite people have got transition again.
Yep, this is from them. And this is how they like to look at their six core elements that they give. Well, yeah, that's mine.
You had
The
a
Yeti's mine. The Yeti's mine. As they look at, trying to stay a step ahead, is that hopefully youth and family are aware that there's a policy. Hopefully the healthcare system has a policy about how they're going to transition youth, and the family becomes aware of this, and the doctor and nurses, the healthcare team starts talking to the family about, things change at 18. And so then you can start putting some of those changes in place starting at 14. Is you start the transition planning. This is where you could start with the transition readiness assessment. You could take a look at the skills and the tools that need to be worked on. Age 16, you really start to talk a little bit more about what does the adult system look like? What are the changes? And this can change according to a chronic disease or condition. Is that the way that you take charge, the way that you see a doctor and the team for like diabetes, control your diabetes, can change when you become an adult. And so you need to be aware that it's not going to be the same people always the same way, as changes will occur. And
changes always occur.
And then hopefully there'll be a transition to the adult model of care around 18, and specialists being transferred from 18 to 23. And then again, it's not complete until we have that integration into healthcare. So we also ask parents, what would they recommend? What's their first thing?
Make a plan.
Make a plan. Is don't be caught unaware that 18 is happening.
Don't charge in head first like a bull.
Make a plan. Don't just do it willy-nilly.
No, never do it willy-nilly.
They also recommend recording everything. This on this side of the page is who I currently see as a specialist. On this side of the page is who I'm going to start to see as a specialist.
Yep. Start a healthcare black book.
There you go. They told us that it helps to break the project into smaller tasks. That was well done. Don't be surprised if things take longer than you expect, especially any transferring of Social Security income or long-term care benefits. Is the system can work slow. Ask questions about other people involved in your health. Get to know other parents, but most of all, be kind of gentle with yourself.
And take your time.
Yeah, take your time. Be prepared. Take your time. So what could you do next? Look at the readiness assessment.
Yep.
Start to have conversations. Take a look at our website. Talk to your IEP team about incorporating healthcare into transition planning. Talk to your primary care doctor and specialist.
Find your local ADRC. If you can't find one local, just
Every county has a local. Every county has one.
Every county has one.
That's right.
But again, if you're not in Wisconsin.
Oh, good point, good point,
And
good point,
everything,
good
find
point.
your local equivalent.
Good point.
Because we don't know if they're gonna just send out this recording to a group of friends or fellow teachers.
It could go anywhere.
It could go anywhere.
It
For
could
all we
go-
know, we could end up in Australia.
And I really doubt it would go viral, but it could go viral.
Or at least your part could. Okay, but most of all, take a deep breath.
I wouldn't be
Right,
surprised.
stay a step ahead of what you need to do. So take a deep breath,
Yep.
stay a step ahead. We'll send this out to you. You also will have Got Transition, national resource. There's our website again. Pacer Center out of Minnesota has some fantastic stuff on transition and independent living.
Mhm.
Up to Me with Wise Wisconsin has a great training on disclose and how do I talk about myself? How do I share my information?
Yeah, disclosure is a really big thing. Oh, hey, Patch.
It is. And then there's our friends at Patch, providers of teens communicating for health. These are teen educators that help to train doctors and talk to parents and talk to fellow youth about the rights and responsibilities of being in healthcare. So it's a peer-to-peer model.
And
of
funny
healthcare.
enough, me and him did talk to a group of Patch kids.
We have.
They're very nice.
And then the Wisconsin Board for People with Developmental Disabilities does have a wonderful self-directed healthcare kit. So we do have their websites on there as well.
Yep.
If you need to get a hold of me, there's my contact information. You'll get this. You don't need to write it down. We
No,
will get
we-
that to you.
Yep.
But the Yeti says thank you.
Yes, the wonderful, wonderful Yeti.
So any questions?
PowerPoint survey.
Yes. Okay. Okay. Ask Hunter questions.
Yes.
While I get the
How he
the
gets-
survey.
Yes.
Yeah.
Yes. There you
Hunter, what was your greatest challenge in transitioning over?
go. Greatest challenge.
Was that mom
transition.
laughing?
Yes, that was mom laughing in the background yet again.
Well, was it Hunter's challenge or was it mom and dad's challenge?
We don't. Yeah. Well, yeah. You can ask us that question as well. But yeah,
Hardest
what was your biggest challenge?
Biggest,
What was the biggest hurdle to overcome? The biggest mountain to climb?
the
What was
biggest
really
mountain to
challenging?
climb was setting up the appointments and everything, because this was a new doctor and everything. This was a new hospital we were starting to go to. This was a new entire environment for me. And I'm not someone who likes changes in environments.
Mm.
We moved 3 separate times before, and each time it took a little while for me to acclimate to it. And what's so funny back there? Oh, she's in her own meeting apparently.
You're laughing very loudly.
We did not know she was in her own meeting. The more you
so-
know.
Crap, I had a question and I forgot it.
Oh, trust me, I forget things every time, a lot of things.
So are you
That's
like
right.
100, can I ask, Hunter, are you 100% taking care of your own health care? Does that make sense?
More like 90 to 85%.
Do you make your
and
own
everything.
decisions, Hunter?
Yep, I make my own 100%. I make my own decisions and everything. It's just up to other tools like my parents to remind me, the automated setups for reminding me about appointments, and my doctors who take care of the rest and everything. So again, it's like I take care of 90 to 85% of my healthcare,
You're the decision maker.
but I am 100% the decision
That's
maker
awesome.
at the end of this road and everything.
But do you make all of those decisions alone?
Never make any decisions alone.
Yeah.
But you
and
know,
so-
I would think that's probably most of the human population, Hunter.
Mhm.
You know, I don't think your dad would totally, if there was something serious, would totally make all the decisions without talking to your mom or whoever.
No.
So I wouldn't worry about that.
I'm
Because-
never going to worry about that.
But I do have one question, maybe more toward Tim, and that is, you have background in all this healthcare stuff, and you've probably come upon a few stumbling blocks, but what do you recommend for the parents or caregivers of individuals with disabilities who come upon these like moments where, oh my gosh, I don't know what to do. I'm freaking out. I don't know who to go to. Do you recommend, I mean, there's lots of resources, but like maybe a one resource go to?
Yeah, I wish I had known about the very place that I work with. So I wish with Hunter growing up, I wish I'd known that there was a regional center for children and youth with special healthcare needs. One of the things to remember is that we go from birth through 21, and so we can help with that transition process. The other thing that so call your regional center when you have those challenges and your glitches and say, I don't know what I'm supposed to do. We love to talk to people who don't know what they're supposed to do.
And like if
because
they
we
call
want to help.
the general number and you explain the situation, that person knows who to transfer you to.
Absolutely.
So
They'll
this
get you
can
to the
be
Southern
a
Regional Center.
lot easier to have your agency help
Mhm.
walk these families step by step into a process that can be very difficult, complicated, scary, so forth. That's awesome.
Yes, and what we try to do is we try to break it down, like we were talking about in little steps, is we try to break it down into the next step, then call us and work on the next step. Because transition itself is just so overwhelming. There's so much that's involved in transition that you really do need to break it down into smaller steps.
Awesome job. You just put the phone number on there. You bet.
I made sure to press enter for him.
Also, if people don't know, the I don't know what you want to call it, children and youth with special health care needs is throughout the entire state of Wisconsin, but you're divided up into 4 regions, correct? 5 regions. Was there 4? Oops. Okay, 5 regions, and you cover 14 of our counties.
Yes.
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 That's the big key there is there are 5 regional centers out of every county out of this entire state, and he is part of 14 of them.
Yes.
True.
Yes. And I think we're the northern, Adams and Juneau are the northern border of your,
One of the 2.
Yes, you are.
yeah, we're
One of
quite
the
a
2
ways
northern
away.
regional centers.
Yes, you are the northernmost that I drive. Is when I drive up. I think it might actually be when I drive up to Adams.
Yeah.
Maybe one of the furthest points north.
Well, probably
that I get in my
slower
region.
because we have the interstate all the way and you got to get off at the Dells to get up by her. Or, you know, you could do the interstate and cut over along scenic route, but in any case.
And I am looking forward to traveling back up
Hey, we're
sometime
looking forward
soon
to
that I'll
having
be
you
able
up
to get
here.
back on the road.
Yep.
So that's my hope.
Awesome.
Yeah, one of these days,
Mhm.
one of these days, you're going to finally go mobile once more.
Yeah. And so I guess the other thing that I would say is that, you know, what Hunter said is be patient with yourself,
And take your time.
plan ahead and take your time.
Absolutely. You know, and I'm going to cut in here and take over your role for a moment and say, we're sorry that we've exceeded the 7 o'clock time, but I do want to take a moment to thank Tim and Hunter for taking the time to do this awesome presentation because healthcare is scary for anybody, but then when you look at more significant needs, it can be very, very scary. So it's just good to know that having Tim and his agency available to help us through these things and the questions and the decisions and such. Awesome. And thank you again for a great presentation. And while I'm on here, before we forget, we do have actually 2 more transition talks Tuesdays, with the next one being Tuesday, not March 3rd. And that's higher education outcomes. So Tim, help me out here. I know we have someone from UW La Crosse and somebody from Western Technical College, correct?
Correct. Well, Christian Follensby from
Christina
Wisconsin Tech
Follansbee, yep.
and Jennifer Bell
Yep.
from La Crosse. UW La Crosse will be here.
So we're looking at not just a university, but also a technical college, and that people understand that when we talk college, it can be either or. It does not mean only a 4-year college. Technical college is a college. So I'm looking forward to that, and we hope to see everybody soon. And Tim, I'll let you have the last word.
No, I'll let Hunter probably have the last word, but thank you all very much. What's your last words to everybody?
take your time, start that healthcare black book, and always ask the right questions.
Just flat out ask questions.
Yes.
Don't be afraid to ask questions.
No, never be afraid to ask questions.
All right,
It's
thanks.
better to
Neil.
question everything than question nothing.
Thanks, everybody, for joining
Yes.
us. Good night.
Good night.
Bye.